DSTV go bump you up to the one above that at no extra cost. It's that simple. So let's say you have access, okay? All you do is pay for family, and DSTV will give you compact at no extra cost. Follow them with the hashtag DSTV Step Up for more, or just call them on 0302 740 540. Thank you for listening. Go and get yourself a DSTV treat. Okay, now before we settle into our conversation about solutions, Enimwa has been out and about. Is checking out what's happening in some of the schools in our local communities. Enimwa, tell us, where are you and what's it looking like this morning?
Hi, Kojo. At the moment, I'm at the Kotobabi 3 basic school, but I'll get to what's happening here in a second. Before we got here, though, we went to Akwani Town, A&T 3 basic school. It's a compound with 3 different schools. Now, in the first place, you would notice that this morning, the children are actually better masked up than the adults. So driving through Kotobabi, observing parents taking their children to school, and even in their interactions, you find out that the adults are not wearing face masks. So in the first place, we're not exactly setting a very good example by not wearing our masks. So that's the first thing. So anyway, so we get to A&T based school. We're greeted in a school that has about 900 people. At the moment, they only have 3 Veronica buckets. The assistant headmistress told us that these buckets are from last term, and they're waiting this morning to receive the PPEs that the government has promised them. So that's what's happening there. Also, again, you find out that some of the teachers have the masks underneath their nose, their chin, and some of the children, I would say about 40% of them did not have face masks. Obviously waiting for the government to provide. And this is a relatively poor community, so understandably the parents may not have enough money to be able to buy face masks for the children. So that's what's happening at the A&T basic 3 basic school, which has a complete population of 900 children working with 3 Veronica buckets this evening. She told us that the CS has gone to pick up the supplies. She's on her way with the thermometers and the face masks and other PPE that the government is supplying. So on our way back, we'll find out what's going on with that. But now, like I said, we're at the Kotobabi 3 basic school. The situation is different here. I've seen about 12 Veronica buckets, also serving about 900 people on the school compound. There are about 40 students per class. So it's spaced out, but not as spaced out as we would like. There is a strict adherence to the wearing of face masks here. I've noticed the teachers are enforcing the COVID-19 protocols as best as they can. Luckily, we count on the Municipal Director of Education for Ayawasu Central, who also has oversight over Ayawasu North, Mr. Augustus Owusu-Adjemfa. So I'm just going to have a quick conversation with him. Good morning, sir.
Good morning.
Thank you for agreeing to talk to us. Okay, so in the first place, do you feel like the district is ready for the reopening of schools as has started?
Yes, we are ready. We can see that the environment is peaceful, teachers are in class, and so we are ready.
Okay, so what are the protocols that you've laid down for your district?
Over the weekend, we made public announcements informing all parents that their units are supposed to come to school, their children are supposed to come to school. As they come, they have to wear their coming from home to school. Teachers cannot come and give you nose mask. Therefore, you can see that every child who is coming wearing nose mask as a result of the education that we do. And these parents are concerned. So, everybody here, teachers, staff, is in nose mask. And we have a lot of volunteer buckets around that. We hope that they are washing their hands before they enter.
Okay, so let's talk about spacing for a second. There are about 40 in a class. What's the plan? Because as much as we want to keep them apart, we also understand that structurally you have, there's not much you can do because there isn't a lot of space. So they're seated a little bit too close to each other than what we would have liked. Is there a plan for that?
Yes, the plan is that classes that are large, they find a means of dividing them. That is when they are very large. But generally, a class of 40, what we try to do is make sure there is some spacing so that the students are not too close. That's obvious what you can see from the class. We cannot go as we did in the industry because obviously all the students are in school. So we don't have any extra classes where you can do the one interfacing. But we do our best to ensure that we are not too close and make all the teachers and sensitize them to be sure that this is a healthy space. And myself and the team, we also bring them to make sure this is being adhered to.
Okay. Have you received all the PPEs that the government promised?
No, we have not received all of them, but we have some stock from the previous delivery, which we have used as a starter before the main ones come.
Okay. So you have thermometers. I haven't seen any thermometers. I mean, I do get that class has started, but were you able to take the children's temperatures this morning?
Well, that one, I guess the head teachers could do because they had meter guns from the previous, which is not a perishable thing.
Yes.
So we expect that.
The headmistress is here, and so we'll catch it.
Okay. So we expect that those ones are there that they use to check the students' temperature.
Okay.
And the principle is that they check and they write the person's name and the temperature daily.
Okay.
So that if there are extreme temperatures known immediately, we need help people to take the necessary action.
Okay. So what is the protocol for if there is one case reported in the school? What's the protocol that's laid down? And that's what
right. I'm not health expert to know the effective. When the schools check, what we have discussed with them, when they check the temperature and there is an extreme high temperature, we have mapped the schools to help us. We have the contact of all those health.
Okay, so this school is mapped to a health facility.
Yes.
Okay.
Yes. So then they call those health facility officers, and then the people come in, and all of them are close.
Okay.
Immediately, and we also in touch with the director of Ghana Health Service. Even this we have spoken with her, and she has dispatched nurses to various schools. So they will be coming around and we will also ensure that things are happening.
Okay. Well, thank you very much. That's Mr. Augustus Owusu-Adimfa. He's the Municipal Director of Education for Ayawaso Central and also has oversight over Ayawaso North. Now, Kojo, I have two students with me. I'm going to speak to them very quickly. Good morning. What's your name?
My name is Sadirana.
Okay, so how did you get to school this morning?
Well, we came early in the morning. They were up there.
No, I mean, how did you get here? Did you walk? Did you take public transport?
Yes.
Okay, you walked. What about you? What's your name?
Charlotte.
Okay, did you walk as well?
Yes.
Okay, so both of you live around.
Yes.
Okay, so when you were coming to school, did you have your face masks on the journey here?
Yes.
You also had it. Did you notice some students or some parents and adults who did not have their face masks on? Okay, and how did that make you feel?
I was surprised.
Why were you surprised?
Because we heard that cases were painful and they were supposed to wear their masks.
Okay, were you surprised as well?
I was shocked.
Why?
What the president said, I thought some people, almost all communities very young class. But some of them, some were not, some were like, they didn't even listen to one person.
Okay, so how did you feel coming back to school? Do you feel safe?
Yes.
Why? What is it that makes you feel safe?
Where the pastor we like, we observe all the safety protocols.
Okay, what about you?
The teachers help us to go through the safety protocols, like giving us sanitizer, face masks, providing water and food
Okay. Same with you, right? Okay. Thank you very much for talking to us. So, Kojo, this is what's happening here. I also have the headmistress. So let me just quickly confirm that question about temperature being taken this morning. Good morning, ma'am.
Good morning.
So, we're just wondering if you had received the thermometer so that you could actually take temperatures this morning.
We'll see them.
Okay, so you've taken the temperatures this morning. So that means every day you have about 900 students.
Yes. We have about 900 to take the temperature. Yes.
Wow. And how many teachers? How many teachers to do that?
We have about, totally, we have about 22 teachers. So, most of them will do that.
So 6 teachers to 900 students.
Yes. And I have a KG separately. That is, teachers, the KG, they also take theirs. And the KG enrollment is part of the 900.
Okay. How many hours does it take to take the temperature of about 900?
It takes about 1 hour plus.
Are the children having to come to school a little bit earlier so that they can?
They are so anxious that we have come back. So they come. Today, at least they came their numbers. At 7 o'clock, they were here. Most of them.
Wow, that's interesting. When are you expecting the next stock of PPs?
We are waiting for our students to tell us. They said they would come in very soon, but we are still waiting for them.
Okay, so at the moment, the parents are buying face masks for the children.
Yes, they are buying the face mask.
Okay, so the stock that you have, because you have some a little bit. Okay, how long will that last for?
Roughly for about 2 weeks.
Okay, so for the next 2 weeks you are covered.
Yes.
So when a child comes to school, perhaps from a poor family and they cannot afford the face mask,
We give them, we buy it for them.
you buy it for with from the stock that you have or with your own money?
With our own money. Wow, it's not enough. So with our own money, we buy it for them.
And there have been cases like that?
A lot.
A lot of the children come from families.
They come with that mask.
Wow, because you're hearing that some of the children come without masks and the teachers and the headmisters are having to fork out money to buy masks for them. So attention, Mr. President, here's your memo. We are waiting for the PPEs to be delivered to the public schools so that the children will be protected. And I'm sure you can hear the headmistress telling one of the children who has come to school without a face mask. Her face mask is in her bag and she's taking it out to wear it. But of course, what can you expect when you're walking and you see adults on the road not wearing face masks? It's up to us to set a good example for them. So, Kojo, that's what's happening here on my side of town.
Thank you so much, Nimwa. And I was interested in the toilets as well. The number of toilets, cubicles, and facilities they have for a school that has about 900 pupils. I don't know, is Nimwa still on the line? No, I think we may have lost Nimwa.
No, you haven't.
Oh, good. There you are. Were you able to check the number of toilet facilities that the school has?
Okay, so I'm just speaking to the headmistress about that now. She's telling us about the state of water in the school.
We have a borehole. So every day we have to pump the water. That's what we do.
Okay, and how many toilets do you have?
We have boys, floor, and then just for each floor. And we have 3 floors.
Okay,
The kids have theirs separately.
12. Okay, so 12 for the 3 floors.
Right.
And then the KG have theirs separately. So, Kojo, they have 12 toilets, 4 on each floor. And then the KG have theirs separately. And luckily, they have a borehole so they can pump water. So they have readily accessible water.
That's a relief. Thank you.
Yes.
Thank you so much, Animwa. I know on your way back you'll check with the other school, that school you were first at this morning, and see what their situation is as well. Thank you. Animwa there, and she's out and about all day, checking to see what's happening with the schools in our local community. You'll probably hear a bit more about her findings on subsequent news bulletins. But let's get into our conversation about the solutions. Dr. Bill Senyo Hossi, okay, we know the problem. So let's start from this school's situation. And perhaps we can focus all our solutions from there into the other aspects of the fight against COVID-19. But let's start with the schools. We're sending our kids out in the morning hoping that whatever we have taught them they will do, that is if we even believe COVID exists and have, taught our children what to do, then they will go down the street into the trotro or whatever, into school, sit in a classroom or whatever for several hours until 3:30, and then they have to maintain whatever they've started doing in the morning, maintain the discipline all the way till afternoon, and then do everything in reverse, come back in the trotro and whatever, walk down the street to the home. We're worried about them. And the government schools, the public schools, clearly there is a huge gap between how prepared they are and how prepared the private schools are. Where do we start solving this problem from? Senior, I'll start with you.
Well, yesterday you made a submission that was very, very critical. We have our infrastructure highly overstretched, and going back to school at this time may also heighten the risk of further infections and further burdening our infrastructure. So we need to find a way. So bottom line, strategy one, minimize the impact you can have on the infrastructure we have now, mainly the hospitals, by minimizing the cases out of going back to school. And then the decision going back to school is taken, and I can identify with those who are in for it. So there are a number of ways to do that. I think that, like I said yesterday, that we start maybe with the private schools. All those with the capacity to run virtual options should start delivering that. And the Ghana Education Service must take a very active role in trying to assess who can and who can't. And those who can should be made to deliver that. So we minimize that engagement. I can understand that we can't have a whole generation lost because of COVID. And it can easily happen. The future workforce is dependent on the children we prepare today, and there's a need for us to find a way to still educate them. So where there are virtual options, deliver it. Where there has to be an option for parents to choose physical and virtual, enforce it. But you are going to have a larger group of people who will not be able to manage that. So we have to really look at the exit from the house and how the path into school and life in school and back home will be. How do we minimize the risk along the entire chain? Yeah. One, people going home in their regular vehicles, relatively the middle class, the elites, that will not be a problem. So transportation is one part of it. But those who possibly were like me in my school days when I was a CI2 boy, we are likely going to have to go and line up at a station, join a trotro, or line up at a taxi place and pick something and go. That's where it starts, our public engagement. So yes, the protocols require that the children have masks. The question is, do we have everybody with the ability to afford masks? There are certain societies that can't. Let's be honest about it. And I'm not surprised that your reporter has indicated that in some places. I saw a picture yesterday, and I just hope it's just... I think it should be real. Somebody's trying to use paper, and a rubber band, trying to wrap around themselves as a face mask. It's not a viable option. I think that for the public schools, the deprived public schools, I'm not talking about Christ the Kings and Bishop Bowers or Martyrs of Uganda. I mean, even there, wherever there are deprived people, I think the state should work with the local producers of the mask and have masks delivered to every one of them. I mean, there's been so much waste in this country that cannot convince me that we shouldn't be able to do this if we want to. All right, so if we want to do it, let's have this done. So we need to make sure people have the mask. Those who can afford should be responsible enough to invest in that. It's your child. You have a role to play. That's one. The next thing I see is in the trotro, and the kind of protocols that are enforced at the stations. Do we have an enforcing mechanism? How well are we working with the GPRTU and all the other transport unions to ensure that the protocols are well defined and enforced, and they have some self-regulation amongst themselves? I haven't heard of any Maybe it's there. I've not had the privilege. I went past stations and I didn't see any organization there. I think we can improve on the organization at the various places. Ghanaians must remember, these are our children. They are our future. We all have a responsibility to help take care of them. In Africa, the adage goes that it takes maybe a couple to actually birth a child, but it takes a whole community to raise one. So we all have to participate in that. These are our children. We have to do something. So make sure the protocols are in there. The next thing is, what protocols do we have in the public transport? I am advised, and I stand to be educated and corrected, that the restrictions we had in the trotros have all been lifted.
Yes.
I don't know the science behind lifting it, but if there's science to support it, at least we also have to make sure that the people in there are fully compliant. But if you have the protocols at the various stations and they have proper education with the drivers and the GPR transport unions, they would enforce at least the mask wearing at a minimum. I wish we can have sanitizers in the trotros, but I don't think it's a viable thing for most of the public drivers. It is an ideal thing, but the investment in there will be quite difficult for most of them. If they can, then it will be a great thing. So I'm just looking at the map, the walk of this child into the school. Eventually, the child is in the school. How equipped are our teachers? That's the first thing I would want us to really answer. Because once they enforce and they take the responsibility and they have the resources, it's much easier for them to really enforce it. But the truth is, it's difficult to have a child in a mask throughout the day. The child leaves home at about 6:30 and 7 o'clock, may close school at about 2 or 3, and may have to get home at about 4 or 5. And you think this child is really going to be in a mask all through? It's just impractical for us to really expect that it would fully happen. And it would need a lot more education with the children. I have been worried, especially in some of our schools. Before you see the mask itself become a matter of branding competition. Somebody wants to see how somebody's own feels, and we see children start exchanging. But it also has to do with a bit more of the education and enforcement of rules in the school. So the teachers have a big job educating them constantly. I would recommend, a COVID break. I would recommend a COVID break for most of our kids intermittently, where they can be allowed to spread out somewhere and probably ease off on their mask where it is where the science can support them. They give them a real COVID break. Otherwise, they'll create their own COVID breaks. And in that moment, once they are all spread out loud, you can also educate them as well again, and then get them back. So constant reminders of what COVID and how there should be in the curricula. There should be a 5 minutes COVID break at some point. That may allow people to spread out openly and then take off their mask. Feel free a bit for some 5 minutes. This is my honest opinion. Wear it back, come back, take another 3 minutes reminder of COVID and how the protocols should be enforced. At least we'll be able to control a bit more of the loose factors around it. So in summary for me, one, let's look at the part, make sure the children are equipped. Those who can't, we have to help resource them. And to the extent that we can avoid children going physically to school, let's avoid them and then promote the virtual options. It is a very viable one. But children are being educated virtual today. It's getting them a bit more busy, and they are doing homeworks all the way to 8 p.m. It's quite heavy on them. I don't think it's impossible. It's just a little burden on some of us as parents, but that's our responsibility. It's a responsibility we have to them as children.
Thank you for that. And you've kind of walked us through what you described as the value chain. Made some very interesting points there. Kwame Sapon-Sedu joins us via Zoom in a moment. But before that, Dr. Beo, you've just heard from Enimwa the gap between the public and private schools is a chasm. It's massive, and the state is crawling, in its journey to equip these schools. What interventions can we put in place in the meantime for a school with 70 kids in each class, waiting for Veronica buckets. What can be done in the meantime?
All right, thank you. Good morning to our listeners again. And I think my wife drew my attention that my name was massacred by one of the callers. It's
Yes, we call you
Bayu and not Bewu. So it's Bayu for
Bayu.
that. Now, I would say that we should look at practical measures that we can do. First, I would encourage parents to consider the option of homemade cloth masks. In the absence of government providing things like masks, these are simple things that we can do to contribute our quota to this fight. We all agree in principle that schools must continue. So how can parents help? The disposable masks are expensive. You have to keep changing them. So if you sew 2-3 masks for your kid, that'll be enough for the week. They can take it to school, come back, wash it. Each time they are going, they can have a pair and all of that. Now,
Are they equally effective? I mean, is it a bit harder to breathe through the cloth masks?
No, it depends on how it's made. And the FDA has standards for making them. If you make a 3-ply with a stiffener in between, it feels a bit difficult to breathe, but it is equally effective. It's like the disposable masks we wear as compared to the KN95 or the respirators. Their level of effectiveness differ a bit, but for community prevention, these masks will be safe enough. So if you sew them for your kid and they wear, it's better than not wearing anything at all.
Yeah.
So and it's cheaper because then you don't have to keep changing them and you can wash them. Now I think that the education system should allow teachers to be innovative and managers to be innovative. And I think this is in line with what the Medical Association issued in our statement when we said managers should put in place measures to ensure compliance with the protocols. So for a school with 900 people, if you have 2 Veronica buckets, the probability that they'll be queuing to wash hands, and therefore that will even deter people from washing hands, or the period of queuing will disrupt all your social distancing protocols is high. So how can the people be innovative about this? Are they permitted to appeal to parents? Are they permitted to appeal to corporate society? Or everybody's relying on government, and until government comes in, nothing happens. Chiefs, local authorities can take interest, visit some of these schools, because we are looking at the self-help spirit of the Ghanaian at this point. Somebody driving by this school, somebody who has heard this report, your kid may not be at that school. But let's remember that the community is one. So your kid may be attending the Morning Star, the Christ the King, where all the protocols are being obeyed. This kid will go to this school where the protocols are not obeyed. Well, you think your kid is safe. Wait till they meet at the mall. Wait till they meet at a playground. Wait till you meet them at church. It's a continuum. So to the extent that the last child is not protected in the country, no one's child is safe. The other thing is, children learn more by observation than by instruction. And so to the extent that parents and teachers do not show them an example to observe, it's very difficult. We are creating a false safe zone in the school. And it's the same thing that we applied in the adult situation, where we ensure that churches were obeying the protocol. You go to churches, you have to wear your masks. Without it, you can't enter. The spacing is observed. But the route from your house to that church is not the same. The transportation is not the same. So now we are creating the same thing here, where we are insisting on the protocols in the schools. And I must admit, they are doing very well. But the community from where these kids are coming from, nothing is existing there. So it will not be sustainable, because the kids learn by observation. First few days, with the head teacher shouting on them, they will obey. By 1 week time, they realize that this whole thing, why is it only here? So let it begin in the community. Let the self-help come up. Let's look at cheaper options like cloth masks, and then we'll be heading somewhere.
Yeah, we all have a role to play. That is an expression that I want us to come back to in a moment, because I have an idea, something that perhaps I'll suggest to everyone, and we'll see if it's doable.
Okay.
Kwame, the thing about Ghana is that we embark on projects. Returning our kids to school is a project. And the weak link in all the projects that we embark on in Ghana is monitoring and evaluation.
Exactly.
So we sent our kids back to write exams last year. Has somebody monitored, evaluated that exercise to see how well we did, where we fell short? Have we taken any learning from that which you see applied to this new project of sending everybody back when we have a second wave? How do you see that aspect of what we are doing, the monitoring and evaluation of it, and what can we do to perhaps make it better?
Thanks, Kojo. I was on the Super Morning Show last week with the Deputy Director General of the Ghana Education Service, hosted by Winston.
Yeah.
And he did actually put out a number of things that had been learned from the children going to write their exams. And to put it bluntly, I was quite impressed. At that point, I did say that on paper, it looked like they had learned a lot and they had put things in place. But like I said in the army, all your plans are as good and robust as when they come into contact with the enemy.
Yeah. Yeah.
What Enimwa is giving us is the plans coming into contact with the enemy. At the moment, we are in the pits and the fire is coming from all angles. The learnings were good enough on paper, but obviously we are seeing some cracks emerge.
Yeah.
Now, on the basis of those cracks, from a quality assurance standpoint, what do I think needs to be done? And I would look at the health quality assurance parameters because for me, we are dealing with a health pandemic primarily, albeit the fact that it traverses into all aspects of our society, from our economy to our mental health to our social interactions, everything. The first thing you want to do from quality assurance when it comes to a pandemic is to minimize contagion, and that is to minimize infection. That are classically picked, that the data from universities that opened in the UK suggests, then doing random sampling and testing in the schools, let's say 20 in a school of 900, 30 in a school of 900, would give an initial quick understanding whether there is a pocket of infection brewing. If that is identified, that can quickly be nipped in the bud before it becomes a super spreading situation. That would become a quality assurance framework that you can work moving upwards on the basis that you say that, okay, I have a framework which says if I do X number of tests in this school and 5% come out positive, I am probably going to quarantine the class in which majority of those positive tests have come from. And for the other classes where one or two happened, but the percentage was negligible, I will get the children to isolate at home with their parents for a period of 10 days because we know that is the trajectory of infection. Between 10 and 14 days, it should be weaning off. However, if it's more than, say, 10%, I would, for a period of, say, 14 days, shut that school down and make sure that the virus is taken out of that school before I reopen. By so doing, the school doesn't become a contagion point where while they commute through the trotros, like Senior was saying, they go and play with their friends at home or they go home, they end up infecting their families. More importantly, Senior raised a point in his submission when he said that commuting amongst the middle classes and upper middle classes, because they'll be picking their children to and from school, would not be a problem. In actual fact, if you look at the risk mitigation I'm talking about, that is a huge problem. Because a lot of us go and pick these kids, we put them in the car, we think they've had a busy day, it's hot, and we put on the air conditioner. They are children, the masks are on. There's poor ventilation. If that child hasn't been risk checked through random sampling, the minute they start breathing in the 4x4 or your saloon car, they are infecting you because the proximity is close, circulation is poor, you're breathing in the same air. That is a risk that a lot of middle classes might ignore, but might come back and bite them. It might even come back and bite them worse than people going in trotros, because often trotros, the windows are open and the air is blowing. So even though that risk exists, because of the ventilation, it's gone down. So my quality assurance tip that I would give to government is randomized testing in schools, especially the ones with very large populations. That would help us track this disease. The other thing we can do is what we call zero prevalence studies in our marketplaces, in our trotros and other things, to be able to map the level of exposure of commuters, etc., to this infection. In doing so, we could also be picking the virus, and those who are doing the sequencing could be sequencing at the same time to give us an understanding of whether we have a highly contagious strain or we have the normal strain. These things will be vital moving forward because we cannot afford the schools to close down. That would be my initial submission.
I'll hear from you last on the school situation, and then we'll move to other aspects of the fight. And then at the end of the conversation, we'll wrap up with the schools again. I'm very keen on that. But Winston, I'm thinking about sanitation, the provision of water, and one aspect of this fight that I don't hear enough about. Look, right now, is it? I mean, are we aware that every waste basket is now clinical waste? Every waste basket.
That's true.
Yeah.
Everything you put in that thing is a suspicious item because it's been handled by someone. We put our face masks in there. The water that gathers at the foot of the Veronica bucket, I'm sure someone comes along and just picks it up and pours it away, not thinking about whether some of it goes on their hands or feet or shoes or whatever. Are we actually thinking clinical waste, and that every waste is now clinical waste? Just a thought that occurred to me, but I'm sure you have your own thoughts as well.
Exactly. I'll get back to I'll get to that shortly. But Kojo, so this morning I was talking about some schools having 70 pupils, 80 pupils.
Yeah, we have to split the classes.
And you're asking yourself, how do you deal with it? Now, the deputy director of GES, when he was here, said, well, they will look at each school according to its problem. The challenge is that while we wait, it could take a very long time because the head teachers would have to resort to their district directors, they would get to their regional directors and get to the GES. We need that policy now. If you have schools where you can't practice social distancing, you split the classes. We've seen it at Christ the King, for instance. So the first class comes for 3 days, another comes for 3 days. You do that so you ensure that you are able to ensure social distancing. Now, the issue of the mask is very important, but I'm also looking at the trotro system, and I'm asking myself, is there a possibility that we can have special arrangements for school children? Not the current trotros that we have, but we have a lot of Ayalolo buses in this country that have been parked at their stations, not doing anything. Now is the time to begin to think, how do we use these? Now, Sonia talked about, online education. And I am convinced that GIFEC has a major role to play. I mean, the issue about connectivity, when we were faced with the first challenge, we gathered people to actually start the local production of PPEs. GIFEC over the years has been mandated to ensure connectivity throughout the country. Areas that telcos find it hard to reach, GIFEC should reach there to enhance connectivity. For those who cannot afford, the state is responsible for the welfare of the citizenry. It is that reason why we set up
a public sector COVID fund to help us in the fight against COVID-19. The government has been giving freebies, giving us free water, free electricity. I think one of the things we should focus more on is connectivity and gadgets that people should use. The university students can afford to have systems in place, loans that they can take. For the secondary school children who cannot afford, we need to have that conversation. Look, you have tertiary institutions reopening, and at the University of Ghana, they say come in there and resort to online education. What does that tell you? It tells you about the viability of online education. And I think that if there is one thing that we can take advantage of and through COVID-19, it's our ability to make a lot of our children, if not all of them, know IT, to make them educated when it comes to information communications technology. And you can only do so when you put the appropriate state institutions to work. They have mandates. Look, GIFEC will tell you, we have sent an ICT center to this place. We teamed up with this. This is the time that we need to assess the work they do. And this is the time that we need to ensure that for all who cannot afford, and I like means testing. Look, we're not saying give it to everybody. Senyo can afford. Dr. Bay, you can afford. I can afford. You can afford. But those who cannot afford, the states should be assisting them. And when I say the state, I'm not saying government. All of us who can afford should be helping to do this. Because you see, I end on this note. One of the main solutions to COVID-19 is for you to look at yourself and see yourself as a problem and the solution at the same time.
Wonderful.
You are the problem because if you do not do the right thing, you're going to infect the next person. You would contract it first and foremost and infect the next person. So the solution is for you to do the right thing. And that is why I think that those who are selling face masks at exorbitant prices should desist from that. There are times when you make profit. Don't seek to make profit during a pandemic. Seek rather to help society.
Imagine in the north selling a face mask for 3 cedis.
3 cities.
Honestly.
So to add to the last bit of it, that you are the solution, you should do the right thing.
Yeah.
In this pandemic, not only you doing the right thing, but encourage the next person
Exactly.
to do the right thing.
Exactly.
It's very important.
Exactly.
Do the right thing yourself,
Yeah.
but encourage your neighbor to do the right thing.
If others are not safe, you are not safe.
We
at
are
all.
just as safe as our neighbors.
Exactly.
Yeah.
So we can't be looking at it just in
When
isolation.
we come back, we're going to broaden the conversation. The problem is big. I mean, the schools are just one aspect of it. How do we deal with the problem of healthcare provision? Spaces in hospitals. How do we deal with the problem of correct and proper reporting? Recording and reporting of data. How do we deal with the issue of research and the problems are plenty.
Before you go, I mean, please, before we get off the school thing.
Yeah.
The suggestion that came from his submission about us really looking quickly at GES, come up with a clear policy on space and the number of people in a class.
Yeah.
That must happen. It should happen like now. And based on that, there should be policy that governs larger classes.
Yeah.
So if you're going to split classes, go back to a shift system. In fact, those who are not used to it, those of us who are excited, we know how to go morning, afternoon. So whatever it is, something has to be done so we can have that. But that policy position must happen about now.
Yeah.
And it should be known. You see, I think this came up the first time. When you have a policy that is not known to stakeholders, we cannot monitor it. We cannot help with the implementation. So if you tell me that any class larger than 50 will be split, if I send my word to school and there are 70 in the class, I can speak up to the headmaster. What is happening here? But if we don't know the policy, then we are not able to.
Governance is a difficult thing, I must admit. And you see what Kwame was saying. I mean, there's a need for random testing in the schools. It's not in doubt. The sustainability of that is where the problem is.
Even the starting of it before the sustainability.
You see, even we are not able to. We are struggling managing with tracing.
Yeah.
Then we are now looking at random testing, which is he's absolutely right on
that.
No two ways
easily
about
be done.
that.
It's needed. It's
It's
completely
needed.
We must have.
Yeah.
How can you come in?
Could I comment on that?
We need to have proper commitment from government on that entire testing and tracing structure.
Let's hear quickly from Kwame, and then we'll take a break.
The point is, if we have to do, random testing, it initially doesn't need to be PCR. We've already committed ourselves to do antigen testing at our airport. So that is a starter for 10. And sometimes we have to look at our cost implications and be innovative. And that was why I gave two options.
But remember, that's $150.
No, but that is
no. I can show you some. I can show you some in my office right now that I'm using for free. I'm supposed to get all my staff in all the branches tested twice a week, and I have 3 samples sitting on my desk at the moment. They don't cost that much, but I don't want to go into that conversation because I've had that conversation repeatedly. What I'm saying is that we can have antigen tests. And these antigen tests can be a starter for 10. What then can happen is if they test positive, you can then decide to run a PCR, which then cut the cost of the PCR.
Absolutely.
These things are not rocket science. Once there's a will, there is a way.
Yeah, indeed.
And they are so
I like
simple.
that. So
Teachers
when we come back, we're going to start expanding the conversation beyond the school system to all the other aspects of this this problem. How do we even solve the contact tracing problem? The thing that seems to have completely collapsed at the moment. That and more when we return from these messages.
The maritime sector is important to the growth of the economy. At the Ghana Shippers Authority, our aim is to ensure that we provide the best of service and support to importers and exporters all across the country by organizing seminars on new policies, how to avoid demurrage, resolving complaints at entry borders, negotiating port charges, and promoting the transit trade. So whether you are importing or exporting, we are ready to assist you at no cost. Visit us at Ghana Shippers Houses, Ridge Accra, GPHA Towers, Tema, NCA Building behind Fort Gardens, Kumasi, Takoradi Shippers Center, Takoradi, and Yamusa Building, Kumbihini, Tamale. We also have complaints units at the Elubu, Paga, Aflao Borders, and the Kotoka International Airport, and Takotel, Takoradi. Call us on 0302 666 915 or toll free on 0800 300 55 or visit our website www.shippers.org.gh. Ghana Shippers Authority, providing shipping solutions.
Same great bang. Because the greatest things are born from the smallest of thoughts. Just as your seeds in a rich soil grow to become trees that bear fruits, the Agricultural Development Bank, ADB, helps you sow, invest, nurture, and grow your personal and business plans by serving you with years of banking ingenuity and experience in agribusiness, corporate and commercial banking, consumer finance, e-banking, and many more through our networked branches across the country. Whatever the culture, whatever the dream, we grow with you. Call us today on 0302-210-210 or visit www.agricbank.com. ADB, truly agric and more.
Na lamte busianye last week oh. Nanso this week omo busianye. Dear Nasisa, as Lamte here say Go TV Max drop in price from 70 Ghana cedis to 60 Ghana cedis month. They didn't delay cra. Omoko upgrading one time. CCA ye the sports, entertainment, kids shows, and in Yama Bebre, Abre Lamte Busiamo Monia Jabroso. Be like the Lamte family. Upgrade the Go TV Max CCA. Tier 60 Ghana cedis. Now enjoy maximum entertainment for less. Cafe Dokra. Use the Go TV app no for connect to Go TV Max so and I could pay by the point agent to be in your area for maximum entertainment. Offer valid from 14th January to 31st March 2021. T's and C's apply. Go TV. Love it.
It's learning time. To all moms and dads out there, the Ghana Learning Radio Reading Program is expanding and adding Ghanaian languages to the English lessons so your child can boost their learning. Your favorite primary school teachers in Asante Twi, Ekwapin Twi, Dagari, Dabani, Dangwe, Eve, Fanti, Gan, Gonja, Kasim, and Nzema will take you and your child from KG2 to B4 through 2 sessions of exciting, interactive, and easy to follow Ghanaian language radio lessons that contain stories, games, riddles, and humorous characters. Tune in to all GBC regional and affiliated radio stations near you to enjoy this new way of learning via radio while staying safe during during this COVID period. Ghana Learning Radio. Learn to read, read to learn. This message is brought to you by the MOE, GES, GBC, and supported by USAID.
Repeat on Tuesdays, Thursdays, Saturdays between 4 to 5 p.m. Imagine say water wake up at dawn. You know buff, you know chop. When it vanish for your area for 2 weeks, you not get one drop safe inside your tank.
Hey.
Hajia, our life was in dangerous. Only our neighbor gets water with water tank.
Water tank?
Yes, water tank. Mamma mia, that water tank gets meter for checking water level. That water tank be fine past Kumasi Selendion. That water tank be tough like Ghana Army. That water tank, they carry water pepe, so say some no go left inside the supply tank. What a tank! As my boss, Mr. Poncho, go talk.
Beautiful, durable, with water level indicator and accurate volume of water. Water tank. What a tank! By Duraplast.
Ojam, why you make quiet like that?
Oh, Charlie, I go do some POP, give somebody where the cornice is not fine, cry.
I always they tell you, see, for decorative roses and cornices, the solution be interface. Them have different imported cornices and roses in different designs and shapes. Installing them be so easy, and it go give your customer the finishing he wants.
Ojam, take me go interface right now before I lose this customer.
Interface Limited is the leading supplier and installer of finishing input materials for the building and construction industry in Ghana. Call us on 0274-999999 or visit our website at
www.interfacelimited.net. Facebook Interface Limited GH. Instagram Interface.limited.
Coffee in your cup and joy on the set. The Super Morning Show is always the best bet on Joy 99.7 FM.
Onipenia there. I thought we'd do something a little bit special, and I can see Kwame Saponsidu bobbing his head all the way in his office in England. Yes, what's a music lover who doesn't love Onipenia, right? Now, you know, as always, MTN wants you to experience the safest and most secure way to enjoy MTN Momo, and that is why from the 2nd of April this year, you will be required to present a valid national ID card anytime you visit a Momo agent to perform a transaction. Please note, this is to help you receiving cash and just handling your transactions in a safe and secure way. That is why we're good together. Just Momo it everywhere you go. Now, I hope you've heard Rent to Own is now in Ghana. The planned city extension project, Rent to Own Land and House Ownership Scheme, is available. The Ningo Prampram District Assembly is doing this, and they're doing it with their partner, supported by the Ministry of Local Government and Rural Development and the UN Habitat. So be smart. Where you live matters. Where you trade matters. Apply, own a home and or a fully serviced commercial land or space now. And don't forget to join their affiliate housing cooperatives now. Special offers last up to the 31st of March 2021. So please call any of these three numbers: 05555 30300 or 0577 911 101 or 0557 054 635. The website is newaccra.city. Okay, newaccra.city. So, Melcom Supermarket is now bigger and better. You can walk into any branch and have a wide range of products. Melcom is your one-stop supermarket for all your daily needs. Terms and conditions apply. Melcom, where Ghana shops. Now, of course, in the studio we have Dr. Titus Beo, we have Senyo Hossi, and we're joined by Kwame Sapama-Siedu from England. Winston is also with us, and we are seeking solutions. The COVID-19 problem is big. It may seem insurmountable, but that's just because we haven't started surmounting it. So we need to start somewhere. We need solutions. And that's what we're discussing today. Dr. Beo, I want to come to you. This generally, you and your organization, what are the solutions that you would proffer to the nation in fighting COVID?
So I think that's a good one. We need to look at the solutions. And I think we want to start from the pure point of hope. And that our history shows us that as a nation, as a people, we have done this battle well before, and we can do it well. So we are in the early part of this battle. We did very well, and we should commend everybody for what they have done. So going forward, what are the pillars that would help us get this battle going, like we did before, that we were acclaimed internationally? We think that there are some pillars. First one is accurate and timely data. This is imperative for us.
Let's quickly remind Kwame to mute his phone, just so that because
Thank you, Kwame.
Yeah, Kwame's doing a few other things while he's joining us for the conversation. So we appreciate you for that, Kwame. Thank you.
Good. So we need accurate and timely data as a pillar in this phase of the fight. We must know that we are
honest data.
Yeah, accurate and timely data, because we are in a different state of the battle now. Second, our risk communication must change. It must improve, because we are sending confusing signals. It must be consistent. Everybody must be singing from the same hymn sheet. Next, we think that there's a need for implementation of protocols and policies, and there must be monitoring of these. Then transparency. Then enforcement of our laws. And the last one is we must depoliticize this battle.
Thank you.
If we do these 6 pillars and we observe them, then going forward, solutions are easy and to be at our within arm's reach. Now, in terms of risk communication, I will just highlight on that, and then later I will talk about what we think we can do in terms of case management. For risk communication, I said we need a consistent and balanced messaging. Initially, when COVID started, we were preaching how severe it was. We were looking at what the images were, and Ghanaians were scared. Everybody was being careful. Then we came out with, no, let's spread calm, not fear. And we overdid the calm. And everybody, let's calm down. This is not as scary. Need not to worry. Things are back to normal. We can do everything normal. Then in the same breath, we want to tell these people that this is a serious situation. Then we select situations that are serious and others that are not serious. These are confusing signals. So I think we need balanced and consistent information. The next is vaccine, for instance. We are yet to receive our vaccine. By now, the communication on vaccine should be out. Communication should lead the way. The information, accurate and genuine information, should lead. It should not be reactive or proactive. By now, we should know when vaccines arrive in Ghana, which people are taking the vaccines. In what order are we taking the vaccine?
Where are we buying them from?
What type of vaccine are we taking? What should we expect? There are several vaccines in the world. There's a committee set up by the president that is working. Brief us. Tell us so far, this is what we have done. This is the type of vaccine we are expecting. And people can ask their questions. And we should have correct, so that we can also gauge and measure the expectation of people. Even the developed world are not expecting to vaccinate 100% of their population. Impossible. What is the population that we are targeting to vaccinate in Ghana? So who should expect it? Whilst waiting for the vaccine, what should we do? For instance, our max presently in Ghana is our vaccine for now. How are we preaching that message? While the max may prevent you from getting it, most of the vaccines in use now actually will not prevent you from contracting COVID, but they will make sure that you don't get severely sick to the point of death. How are we spreading this kind of information? And these discussions must take center stage even before the vaccines arrive. If not, when the vaccines arrive, we will have a conspiracy theorist leading the battle.
Exactly.
And now we have to be reactive, trying to spread the information, the good information to counter. Let's lead the way with the good information. And my organization, the Ghana Medical Association, the National Commission for Civic Education, partnered and decided to do these campaigns. I think others should come on board. The committee working on these vaccines should be briefing us frequently and lead the discussion. We should know, what is it costing us? Who are we giving it to? We should not wait till the end. And then we come in and then we all have to rush. I don't know if I can take a shot at the case management, which is what we have an issue with. Because when we were initially at the start of this battle, we had talks of incubators, ventilators, respirators, ICU space, how many beds we had, and some updates. We're getting frequent updates on the numbers we have. That is gone. But we know that now ICU beds are a scarce commodity in this battle.
Yeah.
Most of the people who die, some need ICU care. People have to call around to find an ICU bed. What is our strategy going this way? Now we are looking at solution. In terms of solution, we have suggested, and let me put this out quickly, that if you have a very good plan and you don't communicate it, like I mentioned earlier, your partners are not carried along. So you need to carry the population along. It reassures people. I expect that government comes out and tell us, the effort we put in to get ventilators, this is the number we've been able to get. This is how they are distributed. This is our current nominal ICU capacity. But functional ICU capacity genuinely is this. And I'm saying nominal and functional because it is possible to have 100 ICU beds, but in reality, if you need to put those beds to use, the human resource needed to do that may not be there. There are specific doctors that can intubate a patient who can no longer breathe on his own, so that the machine will breathe for that patient. We don't have abundant supply of these doctors. Anesthetists. We had suggested to government much earlier, do what we call a mapping. Get all the anesthetists in Ghana. We have them in Kolebu, we have them in Konfanochi, we have them in 37. Get their list. Map them out to the regions. I mean, I sit here and I talk sometimes. When we talk, it is a matter of life and death. If you have to be intubated in some part of the Upper West region today, as we speak, you may be as good as dead, because the anesthetist who is required to do that,
it's not there.
You may not find one. So, and if that person has to be brought by air flight or whatever means to come here to be intubated in Accra, that crowds out the spaces here, which is easier.
And exposes the patient to trauma.
Yes, and their family separating from them. Mapping up 5 anesthetists and tell you are in charge of Upper West region. You are in charge of Savannah region. You are in charge of Northeast region. Because of you, we are sending this number of incubators there. Should we have a case, we are training medical officers on how to be able to monitor. We will fly you there, intubate them, give them the protocols, and let them monitor. Because there are doctors who can do the monitoring. They may just not be able to do the intubation. So these are some of the practical solutions that we should make, and not only make, but communicate them so that it inspires confidence in the population. That, look, even wherever I am as a Ghanaian, if I get to the bad state, I'll be catered for. It should not be only in Accra. The worst branch of the disease is here. But as my last check, apart from OT, Savannah, and I think one other region, all the regions have cases now. And they could go severe. So why should it be that in a particular region that you are, for you, if you get severe, it's a death sentence. Your chance of survival is zero. But in some other places, you have a fair chance. So these are the practical solutions we are looking at. We should map out these things. Let us know the figures and let's discuss it so that all partners will be on board. So I think this is where I will stop for now.
Wow, you've given us so much to think about, and you are the first. There's so much more to come from Senyo, from Kwame, and of course from Winston. A few more messages, and then we'll get back to solutions.
What would you do if you have the choice to do anything in life? Build your dream house, take very good care of your family, and plan for a comfortable retirement. Plan a befitting funeral for your loved ones when they depart. How would you live if you knew there was a friend waiting to support you on all of your life's choices.
You have such a friend in Glyco Life Insurance. Glyco Life has all the plans to meet your life's needs: your child's education, your life savings, your mortgage, funerals, redundancy, and your retirement, and takes the burden off your shoulders. So go ahead and live life to the fullest today with Glyco Life Insurance plans. And remember that all our policies are hedged against inflation. Talk to Glyco Life on 0302 218 500 or 246 142. Also visit our website at www.glycolife.com or any of our branches nationwide for more information.
Glycolife, we cushion you for life.
Glyco, we cushion you for life.
Na lamte busianye last week o. Na so this week omo busianye. Edian Asisa. As Lamte here say Go TV Max drop in price from 70 Ghana cedis to 60 Ghana cedis month. Biape, they didn't delay cra. Omoko upgrading one time. CCA ye the sports, entertainment, kids shows, and in Yama Bebre, Abre Lamte Busiamo Monia Giabroso. Be like the Lamte family. Upgrade the Go TV Max CCA. Cheer 60 Ghana cedis. Now enjoy maximum entertainment for less. Cafe Dokra. Use the Go TV app no for connect to Go TV Max so and I could pay by the point agent to be in your area for maximum entertainment. Offer valid from 14th January to 31st March 2021. T's and C's apply. Go TV. Love it.
Hey, is that my grand prize winner? Eh? Yes, it is. You are the winner. Will you share the money with mommy? Okay. You can keep all the money.
Everyone wants the grand prize of 12,000 cedis in Cousins Baby Moment Season 3. Photograph your 0 to 24-month-old child with any 3 Cousins Baby products. Upload it to cousinsbaby.com.gh and follow us on Facebook to discover exciting activities and win amazing prizes. And you could also be the lucky winner of the grand prize, 12,000 Ghana cedis. Get your Cousins Baby products today and win big in Season 3 of the Cousins Baby Moments Photo Contest. Cousins Baby, natural care and protection. This advertisement has been vetted and approved by the FDA.
Hope you have heard rent to own now in Ghana. The Plan City Extension Project Rent to Own Land and House Ownership Scheme by the Ningo Prampram District Assembly and its partners, supported by the Ministry of Local Government and Rural Development and the UN Habitat, are right here in Ghana. So be smart because where you trade and live really matters. Apply now and own a home or a fully serviced land. Wait a minute Don't forget to join our affiliate housing cooperatives also. Special offers last until 31st March 2021. Call us on 055 55 3300 or 0577 911101 and 055 7054 635. Website newaccra.city. Plan City Extension Project, shaping Ghana's urban future.
Coffee in your cup and Joy on the set. The Super Morning Show is always the best bet on Joy 99.7 FM.
Is this thing on? Word.
So what, we get drunk. So what, we don't sleep.
Joy 99.7 FM, and oh goodness, we've been talking about lots of stuff. Solutions. Senyo, Kwame and Titus helping us out there, as well as Winston. But look, start off the year by stepping up with DSTV. Fasten your seatbelts. They're taking you higher with more epic live soccer, exciting local drama, and the best kids shows. So all you have to do from the 14th of January until the 31st of March, when you upgrade your current package to the next one, DSTV will bump you up to the one above it, okay, at no extra cost. So let's say you have access. All you do is pay for family Family and DSTV will give you compact at no extra cost. Follow them with the hashtag DSTV Step Up for more or call 0302 740 540. Keep your text messages coming through. We'll read a few in just a short while. Text messages on the Super Morning Show are brought to you by Glycocritical Illness Plan, GSIP. It's in your best interest to survive. Now, your face shield is designed to protect you from harmful particles flying through the air. That means your face mask may become contaminated while you wear it in public. So wash your hands before and after putting on your shield. Wash your face shield often with soap under running water or clean it with a Clorox wipe. Wear both your face mask and your shield to be fully protected. Thank you. All right, back to our solutions, and I'm going to come to Kwame if that's okay. Look, I'll let you decide which aspect of this fight you want to proffer solutions for.
Now, to think of it, I listened to Titus, and Titus has gone through a wide range of things that can be done from the health standpoint. And therefore, for me, I would look at the community management, because I believe that is where Titus missed out. And what do I mean by community management? I've always insisted that when it comes to our health-seeking behavior, the first point of call for most people, especially now that the hospitals are full, are our pharmacies and sometimes the licensed chemical sellers. So a lot of people are going to the pharmacies with these symptoms as the initial point of call. How have the pharmacies been inculcated in the whole pool of managing this to be able to signpost these people to the right source of healthcare? Because if the pharmacies cannot signpost the people to the right source of healthcare and they cannot seek healthcare appropriately, then they are going to arrive at treatment centers in secondary care late, which means they are going to risk their life. They are going to clog beds longer, because if you arrive in hospital late, the chances of you staying on in hospital for longer, even if you survive, are higher, because your viral load would be higher, your systems would have started shutting down. So we need to start having an honest conversation as to how to tie this loose end that we have failed to tie. Then the point is, do these pharmacies even know where the testing centers are? Because if we are saying that our testing, only 10 to 12% is coming from the official government testing, and the private labs are doing the rest, and the president is saying that they have to key in real time, wouldn't it be a good idea so that these pharmacies know these testing sites? So rather than say, oh, I suspect it's this, go and get a test, they can have a more informed conversation and say, I suspect it is this, and therefore go to XYZ and get yourself tested. I believe these are two things that have to be put in if we want to get these things done properly. And then the last thing would be looking at how these whole vaccine rollouts happen. Where are the vaccinations going to happen? What is the role of the pharmacy in the vaccination? How quickly are they going to get these done? Like Titus is saying, what type of vaccines are going to be used, and even what does our cold chain facility allow us to keep? So if we don't look at all these things and we are just saying, oh, vaccines are going to come, we don't know which ones are coming and all that, then when the time comes for all these vaccinations to happen, we're going to struggle, even if we want to use the other vaccination sites and all that. So these are the things that I would want us to start thinking of seriously as a people, as a means of managing this. Not involving the pharmacies properly, I think is a missing link.
Thank you for that. And it seems we ought to be thinking a little outside the box with some of these possible ready-made solutions in our community. Thank you for that, Kwame.
Yeah.
Singer.
Because my colleagues have really done good justice to it, and a few things I'd want to touch on. We have a wild spread, so we definitely need to first of all stop the spread. Like I say, when your room is flooded, the first thing you want to do is shut the tap before you actually start fetching water off the floor. Otherwise, if the rate is not as much, you are just going to be wasting your time. So we need to pull the plugs on the high rate of spread that we seem to be observing in the country, there's a need for government to come up with a clear policy position on public gatherings again. We need to restore proper restrictions on our public gatherings. The funeral levels, the parties and the weddings and all that's going on, everything must go back down to some of the sizes that government enforced the last time. I mean, I don't think we should be having weddings and funerals with over 100 people anymore. Time limit should be on all these ones, maybe not more than an hour and a half, and that should be done. All these funerals that will need people to go to church, come and eat with everybody, go back again and sit down and wait, all those things must be banned now. People can be buried all right. Very simple services. It works. It worked during that time and it can work now. We all need to sacrifice something, including our social comfort, to help fight this particular pandemic at this time. There's a need for us to restore proper public agency, and it comes from the government. What they themselves do, people are watching, they must be proper examples. All right? I think the government officials should repent from their ways and start being the leaders that we expect them to be, and then let us learn right from them and enforce the laws that they themselves have set against on our own selves. Because we trust them to enforce it against us, we can't trust ourselves well enough. That's why we made them our leaders as well. So they should enforce and exercise the authority that we've given them, and also the largesse that we've also made available to them to enjoy. It's time for them to sit up and help deliver the good for all of us. They owe all of us a duty of care. There's a challenge we have with our infrastructure, so there's a need for quick investments in our infrastructure. The ICU capacity is low. The technical human resource there is a challenge. The GIDC has been up. We've been having issues with the what do you call it? The staff that would have to be there. So what Title said must be taken seriously. The private sector fund will be looking at a new project in Kumasi to have another infectious disease center. We would really be looking at the public and general corporate to really support us deliver this also in another record time, so we can possibly help deal with the new infections that may all be showing up in another 3 or 4 months' time. All right, so we all need to really put our shoulder to the wheel. The government announced the 88 hospitals. We are not sure what structure and plan is really in place, what the resources are, but whatever is available for now, let's operationalize them and get to fight this particular thing. There are other issues there. I mean, there are digital interventions that are coming in. I think the government is already looking at some of these interventions. I don't think people should be coming here with their what do you call it, their certificates and going to airports with them. Should be able to have digital solutions to deal with them. People should be able to upload their COVID status and have them digitally accessed globally. So when people have problems, Africa at least should be able to have a common platform that can make everybody identify who is coming, when the person last had a COVID case, and what the last status of the person is. We need to also ban flights coming from places with new strains. These new strains, we don't know how to manage one. The old one we are still struggling with. Now we have the new one coming. And then we are still going to keep our airports open. And maybe we should relook the kind of testing regime that we want before people fly into town. Maybe people should not be coming with their test just a day before or 2 days before. Maybe it's better for us to take 3 days before your flight date, so that when you come here, you have a negative one. By the time you reach here, the thing should mature, so that our antigen test or whatever it is happening at the airport, too, should be able to capture them. But please, let everybody put their shoulder to the wheel. We can fight this. There's hope. Our situation is not devastating as you see in other countries. So please, let's work together. The media, everybody, put their shoulder on the wheel, and let's get the public sense of urgency back in fighting this pandemic.
Thank you so much, Senyo. Thank you to all of you. Some great solutions there. I think the only thing I'm going to say to wrap up is that I hope the state invest in research. You know, that's rather than waiting to import a solution from somewhere else. Let's spend some money finding a way to solve our own problems. It doesn't have to be in finding a vaccine, but in finding solutions to the many problems that we have described. Research can be the key. And the last thing I want to say is this, that the state really needs to set the example. Otherwise, you lose the moral authority to tell others to do the right thing. In the north, people are selling masks for 3 cities when they cost 1 city. How can the state even intervene when you are doing antigen tests at the airport for $150 when they can be done for $10? So let's all contribute in our small way to make these solutions work. Thank you all so much for listening to the Super Morning Show. My name is Koji Yang, so we're back tomorrow with more. Right now it's 10 o'clock. Fred Smith has the headlines.
Well, the parties in the 2020 election dispute have returned to the Supreme Court this morning. NDC presidential candidate John Mahama is demanding the Electoral Commission admit it made mistakes in the